and my pronouns are they and she.
And I'm Melissa, my pronouns are she and her, and we're part of the MacEwan Anti-Violence Education Network, or MAVEN for short.
Today's video is all about supporting survivors of sexual violence. We will start by outlining 3 stages of rape trauma syndrome and some coping strategies often used by individuals after experiencing a sexual assault. We will also go over the 3 important principles to keep in mind when listening to a disclosure and provide some support options. These can be referred to following any type of sexual harassment or assault. At the end of this video, we hope you are also equipped to provide options for survivors of sexual violence.
Before we get started, just a short warning that we will be talking in some detail about the effects of sexual violence. So if this is something you are particularly sensitive to, make sure to take breaks and practice self-care if you choose to watch this video. A resource on self-care will also be available in the video description.
So we will start by outlining the 3 stages of rape trauma syndrome. This syndrome consists of 3 stages that are usually experienced by a survivor of sexual assault during the recovery process.
While these stages include general timeframes, it's important to clarify that healing is not linear, and everyone will go through this process at their own pace. Going back and forth between stages is also not unheard of.
The first is the acute stage. This usually occurs during the first 2 weeks following the trauma. Some common emotional reactions may include shock and disbelief, which can then give way to fear over physical safety. Other feelings include guilt, shame, humiliation, anger, and a desire for justice. The primary concerns during this phase include attending to any medical needs and possible disclosure. Their behavior can also include restlessness, intense sobbing, or they may appear totally calm in an attempt to mask their emotions. Victims may say things like, "I feel like I'm losing my mind," "Everything is okay, this is being blown out of proportion," or "I can't work or sleep properly and I can't get anything done."
Next is the outwards adjustment stage, or also known as the underground stage. This is most typical between 6 months and 2 years and is characterized by avoidance and denial. The survivor might show signs of trying to put the experience behind them and strive to reobtain some sense of normalcy in their life. It's not uncommon to see them undertake some major life changes during this stage. An example might be them suddenly saying they're going to move to a new city and change their number.
The final stage is long-term reorganization. This phase may generally occur around 1 year after the trauma and continues indefinitely. During this stage, the survivor integrates their experience into their life. They are likely to experience triggers and flashbacks, as well as feelings of frustration. But this is also a stage where survivors are likely to reach out for emotional support and process their experience. They might say things similar to, "I don't understand why this is still affecting me after so long," or "I don't know what I did to deserve this," or "I finally feel ready to talk about what happened."
Next, we'll outline some strategies survivors may use to cope. Keep in mind that coping can look positive or negative. It's best to approach this from a non-judgmental perspective. The best thing you can do is listen, believe, and support regardless.
There are some coping strategies in response to an assault: isolation and wanting to be alone, denial, excess or a lack of sleep, meditation, positive self-affirmations, crying, substance use, keeping busy at school or work, and self-harm. Like Melissa said, these ways of coping can look very different for each person. They may be positive or negative in reaction to experiencing sexual violence. Coping and healing is not linear and can range from one extreme to another. As a supportive friend, it is essential to honor the many ways that survivors cope.
Next, we'll go over some ways to support someone after they disclose an assault. 3 of the most important skills when it comes to supporting survivors of sexual violence are listening, believing, and exploring options. First, listening. When listening to someone's disclosure, allow them to set the pace for the conversation. Don't rush to fill the silence. It's better to give them space than to interrupt or overwhelm. Avoid asking why questions like, "Why were you there?" or "Why would they do that?" Focus instead on open-ended, clarifying questions like, "How do you feel?" or "What can I do to support you?"
Next, it is crucially important to communicate that you believe the person disclosing to you. It takes an extraordinary amount of courage to disclose a sexual assault. Statements that confirm that you recognize this will go a long way. Some examples include, "Thank you for trusting me, and what can I do to help?" And I can see how much this is affecting you.
Finally, we have exploring options. The most important thing to remember here is to empower the survivor to make their own decisions. Avoid pushing what you think they should do onto them. Ask them what they would like to do or what their biggest concern is, and focus on that. The next section of this video reviews a few options that you and your friend can use.
If the person who discloses to you is comfortable and gives consent, within the first 7 days of the assault, ask if they would like you to take them to the sexual assault response team, available through the emergency room at a hospital. In Edmonton, the Misericordia, Grey Nuns, Royal Alex, and the University Hospital will be able to provide the appropriate care needed, including birth control and STI testing or treatment. Another option you can access is the MacEwan Health Center near campus, and they will assist you. They have an on-site STI clinic, an HIV exposure clinic, and an urgent care phone line. If there is a need for immediate medical assistance, call their number and an on-call doctor will try to contact you.
For support and guidance on steps that you can further guide your wellness, you can also contact MacEwan Sexual Violence Response Coordinator Megan Simon. Megan is there for non-judgmental support, whether the incident happened on or off campus. Megan can provide referrals for counseling and medical services, academic or work accommodations, reporting options, and resources for self-care. The Sexual Assault Center of Edmonton, or SACE, can also provide reporting resources as well as free individual and group counseling for survivors. The counselors at SACE are properly trained to work with people who have survived sexual assault and will help without uncomfortable questions or judgment. There may be a 4 to 6 month waiting list for counseling, but there are services available for those on the wait list. There's also a direct support call or text line if you need to anonymously receive advice for yourself or others.
We hope you learned about the after effects of sexual assault can look like and the different options to seek support. This can be a traumatic and unfamiliar situation to be in, and it is normal to be scared or hesitant. Always go at your own pace, and you won't always have the answers, and that's okay. Being present and supportive is the main thing you can do to help. Thank you for watching.